Yeah, so the process of diagnosing a concussion is has several components. First is a physical examination, doing a thorough neurologic examination, assessing neurologic function, looking for any deficiencies in both motor function, sensation, cognition. We also do a real extensive symptom history. A lot of concussion is managed based on symptoms that a person has, and so we have a very extensive sort of list that we go through, and we monitor that as we go in terms of managing the concussions. It's hard to diagnose the severity of a concussion up front. We can certainly see certain features that are more worrisome than others, such as acute neurologic symptoms or signs. Those are definitely more worrisome, but it's hard to give a proper label of severity until the concussion is over. And at that time, you have to consider the entire picture: the severity of symptoms, the complexity of treatment required, and the duration of symptoms, until resolution. All of those factor into, giving it a rating, if you will. But in terms of managing, we manage them sort of, based on how a person progresses. We kind of, follow their symptoms closely, both physically and in terms of the neurologic deficits, and we modify our plan actively as we go. So in terms of managing concussion, the first priority is making sure that the brain is in a safe situation. So we do our best to minimize risk of repeat injury. We do our best to minimize triggers that continue to sustain or maintain symptoms. We do certain medications at times to help with symptoms. We do certain therapies to help with some of the symptoms. Once the symptoms have subsided, then we start what we call the return to play progression, where we do a gradual increase in activity, and that varies from sport to sport, such that over the course of a certain number of days, we advance each day, making sure that the athlete's able to tolerate increasing intensity levels of activity without any recurrence of symptoms. And if they're able to do that, then the very end of that return to play protocol or progression would be an actual full contact live practice, and we make sure that they're able to tolerate all those different steps before they can actually go back to play. So in the past, there used to be certain numbers of concussion that were a standard, where if you had so many concussions within a season or so many concussions within your career, then that would lead to a decision about whether you should continue that sport or not. But it's no longer quite that cut and dry. As we've learned more about concussion, there's more of an individual shared decision-making process. Things that we look for are the number of concussions for sure, but also the severity of symptoms, the length of time that it takes to recover. We look for signs of brain vulnerability, where a patient or an athlete may have sustained a concussion with lesser and lesser degrees of trauma, and all of those things have to be put together between all of the medical professionals, the athlete, their family, in an effort to come to a shared decision regarding return to play.